What if your heart suddenly cried for help, but you didn't recognize the signs? Every year, millions of people around the world are caught off guard by a heart attack. It is sudden, it is life-threatening, and in many cases, it strikes without warning. Heart attacks are often portrayed dramatically in movies: a sudden collapse, a sharp scream, instant loss of consciousness. But real life is very different. Sometimes it is just a mild chest discomfort. Sometimes shortness of breath. Sometimes nausea, fatigue, or a vague feeling that something is wrong. And yet, in those quiet moments, acting quickly can mean the difference between life and death. In this video, we will take a deep and detailed look at heart attacks and acute coronary syndrome. We will explain exactly what happens inside the heart, why blood flow suddenly stops, how symptoms appear, how doctors diagnose and treat the condition, and, most importantly, how heart attacks can be prevented. This is not a video meant to scare you. It is meant to inform you, because knowledge saves lives. How the heart works. The heart is a muscular pump. Its only job is to continuously push oxygen-rich blood to every organ in the body. The heart has 4 chambers: 2 upper chambers called the atria, 2 lower chambers called the ventricles. The atria receive blood returning to the heart. The ventricles pump blood out of the heart. The left ventricle is the most powerful chamber. It pumps oxygenated blood through the aorta to the entire body. But the heart itself also needs oxygen. That oxygen is supplied by special blood vessels called coronary arteries. These arteries branch off from the aorta and wrap around the heart, delivering oxygen and nutrients to the heart muscle. If blood flow through these coronary arteries is reduced or blocked, the heart muscle begins to suffer. This is where the problem begins. What is acute coronary syndrome? Acute coronary syndrome, often abbreviated as ACS, is not a single disease. It is a group of conditions caused by sudden reduction of blood flow to the heart muscle. ACS includes unstable angina, myocardial infarction, commonly known as a heart attack. The most common underlying cause of ACS is atherosclerosis. Atherosclerosis is a long-term process where fatty deposits, cholesterol, inflammatory cells, and calcium gradually build up inside the walls of arteries. These deposits form what is known as atherosclerotic plaque. Over time, plaque narrows the artery and reduces blood flow. In many people, this process occurs silently over decades. A plaque does not need to be large to be dangerous. In fact, many heart attacks are caused by plaques that do not significantly block blood flow until they suddenly rupture. When a plaque ruptures, the inner contents are exposed to blood. The body reacts as if there is an injury. A blood clot forms within minutes. The artery can become completely blocked. Once blood flow stops, the part of the heart muscle supplied by that artery becomes deprived of oxygen. Heart muscle cells begin to die within minutes. This process is called myocardial infarction. Heart attack versus cardiac arrest versus heart failure. These 3 terms are often confused, but they are very different conditions. Heart attack. A heart attack is a plumbing problem. Blood flow through a coronary artery is blocked. The heart muscle is starved of oxygen and begins to die. Cardiac arrest. Cardiac arrest is an electrical problem. The heart suddenly stops pumping effectively due to a dangerous rhythm, such as ventricular fibrillation or ventricular tachycardia. Blood flow to the brain and organs stops immediately. Without immediate defibrillation, death occurs within minutes. A heart attack can lead to cardiac arrest, but they are not the same. Heart failure. Heart failure occurs when the heart cannot pump blood efficiently. It is usually a chronic condition caused by previous heart attacks, long-standing high blood pressure, or heart muscle disease. Symptoms include shortness of breath, fatigue, swelling of legs and feet, fluid buildup in lungs. A failing heart can also lead to dangerous heart rhythms, blood clots, and further organ damage. Symptoms of a heart attack. The most common symptom of a heart attack is chest pain or discomfort. Patients often describe it as pressure, tightness, burning, crushing pain. The pain may radiate to the left arm, the neck, the jaw, the back, the upper abdomen. Other symptoms include shortness of breath, cold sweating, nausea or vomiting, dizziness or lightheadedness, extreme anxiety. However, heart attacks do not always present typically. Women, elderly individuals, and patients with diabetes may experience atypical symptoms such as unusual fatigue, mild discomfort, shortness of breath without chest pain, silent heart attacks with minimal symptoms. Never ignore unusual symptoms, especially if risk factors are present. Risk factors. Major risk factors for heart attack include age, men over 45, women over 55, high blood pressure, high LDL cholesterol, high triglycerides, diabetes, smoking, obesity, physical inactivity, chronic stress, visceral fat around internal organs. Visceral fat is particularly dangerous. A person may appear slim, but still have excessive fat around the heart, liver, and pancreas. Waist circumference and waist-to-hip ratio are better indicators than body mass index. Diagnosis. Diagnosis of a heart attack includes clinical history and physical examination, electrocardiogram, ECG, blood tests measuring cardiac enzymes, echocardiography, coronary angiography. Early diagnosis allows rapid treatment and saves heart muscle. Treatment. Immediate treatment aims to restore blood flow as quickly as possible. This includes oxygen therapy, aspirin and antiplatelet drugs, anticoagulants, nitroglycerin, pain relief medications. Definitive treatment includes percutaneous coronary intervention, angioplasty and stent placement, thrombolytic therapy when PCI is unavailable, coronary artery bypass surgery in selected cases. The goal is to reopen the artery as quickly as possible. Time is muscle. Every minute counts. Prevention and life after a heart attack. Surviving a heart attack is not the end. It is a warning. Prevention includes strict blood pressure control, cholesterol management, diabetes control, smoking cessation, regular physical activity, healthy diet, weight management, medication adherence, stress reduction, adequate sleep. With proper treatment and lifestyle changes, most patients can live long, active lives. Closing message. Your heart works for you every second of every day. Listen to it. Protect it. And when it cries for help, act fast.